Now, I've got news for you from Gilead Sciences. They make the virus treatment, Remdesivir. They've just announced that one vial of the drug will cost $390. Now, with a 5-day treatment, which requires 6 vials in total, the overall cost will be over $2,000 for Remdesivir treatment. Doc Siegel is with us. Seems like a lot of money to me, Doctor.
Here's what you didn't say, Stuart. By the way, it's $3,200. But what you didn't say yet is that Health and Human Services has bought up the whole supply yesterday. They announced it this morning from Gilead, 500,000 doses. They will have dose courses, 500,000 courses they will have by September for everyone in the United States that's going to need this drug easily. And you know what? Medicare is going to cover it, and private insurers will cover it too, Stuart. Medicare covers intravenous medications like this anyway. So the supply will be handled by HHS, it will be distributed, and it will be covered by insurance.
And let's be clear, this is a treatment, a supposedly successful treatment. When you've got the virus, this treats it. Correct, Doctor?
Correct. It decreases the length of course of the illness by about 4 days in a dramatic study that the NIH conducted over several centers. It may be also useful earlier in the game, but during when you're really ill and in the hospital, it cuts down the course of your illness by 4 days and decreases the chances of dying of COVID-19.
All right, thanks, Doctor. Stay there. More for you in a moment. And I want to give you some numbers, too. As of this moment, there are more than 2.5 million cases in this country, and that's up about 44,000 cases just over the weekend. California, Texas, Florida, all imposing some restrictions again. So, Doctor, you were a proponent of reopening. Get on with it, was what you were saying. Was that a mistake? Did we do it too quickly?
Well, we did it in a certain way too quickly. You know, Texas, Arizona, Florida, California have over 60% of these cases. And the problem isn't the reopening itself. It's that nobody paid attention to physical distancing or wearing masks, as Secretary Azar is saying. They huddled close together. So we really needed a laser approach, Stuart, to certain kinds of reopening. Bars are not working. Restaurants, too many people inside that are talking close together. That's what's spreading this virus. It spreads on very small respiratory droplets, and that's what's caused the problem. We had to reopen. The economy was suffocating. Mental health, physical health. But the problem I have is we're putting at risk our elective surgeries in hospitals if we end up hospitalizing too many patients. It's a milder version of the virus right now in the sense that the number of deaths has not gone up. But we can't afford to have people getting sick from this, and so we have to take a surgical approach to what reopening means.
All right, Doctor, got it. Thank you very much indeed.